I'm Jeff Barris, Pacifica Compounding Pharmacy, and I've owned and operated Pacifica Pharmacy for the last 40 years. One of the major and difficult topics that come across is suggested protocols for sleep. In thinking about what I do for sleep and what I do to make suggestions, it has to do with stress reduction, uh, talk about exercise. Anti-inflammatory meal planning is really important. Uh, Plenty of water throughout the day. There's certain herbs and supplements that I suggest that help with anxiety and inflammation and stress. Uh, Also, avoiding over-exercise is significant as well when it comes to sleep. And of course, hormone balance. Hormones, thyroid, adrenals, and insulin resistance. All those things just have to be ruled in and ruled out and dealt with. There's a menu of options that I utilize that help with sleep, and they include things like magnesium, and there's different salts of magnesium that are important. The magnesium threonate is really important because it does bypass the blood-brain barrier and it does get to the brain. It does help relax an individual, helps them sleep, and it's taken in the evening. There's certain adaptogenic herbs, such as ashwagandha, L-theanine, Siberian ginseng, and there's some products out there that have a lot of these together, or we can do it separately. I also like phosphatidylserine, which often I'll use that when an individual says they wake up at 2 or 3 in the morning. What do you got? And the phosphatidylserine does help lower cortisol, optimizes the adrenals, so therefore it's a good option. We also use valerian and even glycine, an amino acid that does seem to help with sedation. And of course, melatonin. Melatonin helps get you to sleep, but a lot of my formulas do have melatonin in them. They're not going to keep you staying asleep, but at least it's a start for some people. There's also other herbs like hops and GABA and hydroxytryptophan, also known as 5-HTP. Relora, which is magnolia bark, and some more unique ideas would be the use of CBD, full spectrum, to help with sleep, because that does reduce inflammation and help one relax. In addition, mindful meditation, I think, is really important. Often people will either have trouble falling asleep or in the middle of the night can't get back to sleep. But if they're able to just do deep abdominal breathing, it really does make a difference. Just concentrate on your breathing and just count to 10. Of course, some people go from 100 down to zero. I mean, take your pick, find out what works best for you. And then there's the use of low dose naltrexone, which is a whole other subject, and we do a Zoom on that every couple of months. So if you want more information, just let us know about it, and we'll get you the information, and you can join our Zoom. It is a meetup in which it's patients and practitioners, and we're finding that the low dose naltrexone, which is affectionately abbreviated LDN, has been really helpful for sleep and inflammation because it does optimize the immune system, and that really is important. So those are the major issues that I find with sleep. Often we'll just start simply with magnesium at bedtime and a product of adaptogenic herbs like Adrenavive, made by Orthomolecular. That would be for morning use, just so that if you can lower your stress throughout the day, you'll sleep better at night. And then there's some formulas I put together. One's called Z Sleep, which has got a lot of the herbs I just mentioned that's used at bedtime. And again, more magnesium. I mean, as much magnesium as you can tolerate without getting loose stool. I think that's really a key with magnesium. And even the glycinate's helpful for sleep as well. So those are what I go through with regard to how do we deal with sleep. And you have to start somewhere as a baseline. And some of these sleep formulas, like the one I mentioned, the Z Sleep, have a lot of the herbs I mentioned in it already in combination. So there's no need to get them separately. So you just take it all in one capsule. So that's kind of the way it goes. If somebody then comes back after several nights and they just could not get to sleep or having trouble for whatever reason, and everything else we've talked about is stabilized, we're going to have to look into other, other herbs or supplements that could be added to it and just kind of find a roadmap or just a solution to this problem. So an anti-inflammatory meal plan where you eat less sugar, carbs, and just products that just do create more stress and inflammation. Yes, definitely regular exercise is important. Trying to go to sleep around the same time each night and try to get 7 to 8 hours sleep if you can is what you're trying to do. It really depends day to day because everybody has different routines. Sometimes it's a very stressful work week and a very quiet and relaxing weekend, or sometimes it's never relaxing. So one has to find out what what keeps them relaxed, possibly a hobby, a passion. All those things are really important factors too, just for someone's just general health and wellness. If you just concentrate on your breathing and think about moving your abdomen in and out very slow and just only concentrate on that and nothing else, you'll find that your mind does not wander if you were just not doing anything and hopefully trying to fall asleep. So um, I think I find that it's most useful slowly counting backwards your breaths, starting from 100, and just go one breath at a time and take your time. And again, it's got to be abdominal breathing. And most people don't get past 20 or 30, I mean, or down to 70 or 60, I should say, when they go backwards. And another trick is to start at 300 and do your breathing in increments of three, where you count by threes, 300, 297, 294, etc. So that has worked for some people too. So there's all kinds of tricks. Again, whatever it takes to just get an individual to relax. Not sleeping, there's obviously some stress going on. They've got to look at what's going on around them. I mean, stress isn't always just emotional. Stress can be the food you eat, the water you drink, the air you breathe. All those things can represent a stressor of some sort and create an inflammatory process. Um, it's good, obviously, to speak to somebody who's an expert in health and wellness on something like that, and who can recognize some of these things and possibly the patterns. Um, it, I think it's good to take significant breaks, whether you get whether you call it a vacation or a weekend or whatever it may be, because all those things you notice a difference when you're not under the consistent stress of day-to-day routines that may be more destructive than constructive in your life. Really, the first thing I let people know is sugar tends to be the most inflammatory thing we all put in our bodies, and sugar comes from either just pure sucrose and sugar or carbohydrates, which turn to sugar. There's bad oils, a lot of things that are inflammatory that create inflammation in the body. Definitely, I start with cut gluten, um, cut sugar and carbs. Probiotics are really important at that point in time. Um, so yeah, that's just the start, and that's a foundation. A lot of times, people's comfort foods are more destructive than something worthwhile. Um, like dark chocolate is a good thing. I'm okay with that. But some people will just crave sweets. They don't feel good. It's like a lot of these sweets tend to be like a blanket for the brain where they feel really good for 10 minutes or an hour. But the problem is then they get really hungry again and it affects their cortisol. So one of the more common things is to do a lab test of some sort. Now, we do salivary testing with ZRT labs in order to determine the hormones, both men and women. as well as cortisol levels, which is really important because if cortisol goes up, which it normally does with age, it creates more inflammation, increases blood pressure, it increases insulin resistance, and then that's important to know. So with the ZRT test for salivary testing, you can do that. Blood testing, of course, is a valuable tool. Also, I don't do blood testing here. I do blood spot testing. There's a lot of practitioners that like to utilize blood. Um, yeah, I just prefer saliva testing. Well, it measures the capillary blood, and you get all your hormones and your cortisol, and you are able to accurately measure that which is in the cells of your body as opposed to what's bound in blood. Because blood testing predominantly measures bound hormones. And ideally, I like the idea of measuring the hormones that are free and available in the cells of your body. Um, Also, capillary blood testing allows us to do a little bit more extensive testing than just hormones and cortisol. You can measure vitamin D3. You can measure a few other unique, I don't have that right in front of me, but there's a lot of unique testing that can be done with just blood spot as well. It's really important to sleep. Sleeping, your body heals when it sleeps. Your brain heals itself and cleans itself out when you sleep. Uh, Definitely, it, you avoid the aging process to some degree with sleep because you have less, wake up with less stress because you've kind of just reduced the stress that you had throughout the day and almost eliminated it. Um, it's almost a cleansing process. It's a refreshing process. That's the whole purpose of sleep is to clean, is to be able to clean yourself out and reduce toxins and just rebalance yourself. So to achieve the health and wellness that you're looking for, sleep is just vitally important.